Hi, I'm Dr. Minerva Santos, and welcome to Your Health Today. My guest today is Dr. Mitchell Rosen, who basically is solving the problem of so many people. One of the biggest complaints I get in the office, and one of the hardest things to do, is lose weight. There's an epidemic of obesity, and Dr. Rosen is on the cutting edge of bariatric surgery. Thanks.
Well, thank you for having me, Minnie. It's a pleasure to be here. And I think that the first thing is, to see integrative medicine. And, you'd say integrative medicine and surgery. That's probably when we went to med school, there was like diametrical opposites. We probably would have sat on opposite sides of the room.
And you calling me crazy.
And it's amazing how we are all coming together, because even though you're talking about weight loss, what we're really seeing is that obesity, a sedentary lifestyle, affects every single organ system. Mm-hmm. And a lot of people who are viewing this may say, okay, all right, so I'm a little bit heavy, my spouse loves me, I'm happy the way I am, why would I ever consider going to see you? And I don't think they realize that we actually can get, with certain procedures, 90% of type 2 diabetics into remission. We can get people who are snoring real loud, so they have to sleep in a chair or get thrown out of their bedroom by their spouse, partner, or anyone else, or using a machine. Mm-hmm. We have a very good chance of getting rid of that sleep apnea machine. We have a very good chance of delaying or treating their joint pains. And what we have to understand is that when you're seriously obese and you have medical problems, you can't split it. You can't just say, okay, I'm healthy, but it affects every part of your body. It even, affects your fertility, your erectile function, and essentially healthy mothers. Healthy people make healthy mothers who get healthy babies. So you can draw the conclusion. So we really are meeting in the middle.
No, and you're absolutely right. People don't even realize there's an increased risk of certain cancers. Mm-hmm. People don't make that connection that I'm overweight and it's affecting my blood pressure, it's affecting my diabetes. They tend to view it as this little separate niche that they have to deal with, and don't realize that if you get rid of this, a lot of the other problems that you're having kind of disappear.
Well, I always say there are splitters and clumpers, okay? And for our mental health and to feel good about ourselves, we tend to split. But the truth is that, and we've reinforced that message. And I think that's one of the positive aspects of integrative medicine, is that when you go see a pulmonologist and you go see a cardiologist and you go see, a bariatric surgeon, which is the new field that I'm part of, or you go see a podiatrist, we're essentially splitting the body into different departments. We're now Macy's. Where we have it, but the truth is, when we were kids, we used to go the hip bones connected to the and the whole body really is connected. And people ask, well, how does what I eat cause cancer? Or I guess they can understand that certain things that we eat, like nitrosamines, which hot dogs have, can irritate the stomach, and if the stomach gets irritated, you can get cancer, or if the bowel gets irritated. So they can understand type of things like that. But they probably don't understand why obesity can cause breast cancer. And a lot of it has to do with the fact that the female hormones and estrogens are all bound in fat. So it's not uncommon when people are heavy, they have irregular or painful menses. At the same time, they can have very heavy periods because of a high estrogen state, and that high hormonal state may drive breast cancer. Same thing can be argued with male prostate cancer. So a lot of the hormonally sensitive tumors are very much linked to obesity, and much more so than we ever thought in the past. One of the great questions I have for you is, how do you define health? People tell you I'm healthy.
Right. But
what do they mean by that? I think in my practice it means that nobody's put them on medications, which means if they have, a different doctor, they become less healthy. How do you define health?
I actually look at health in a bunch of components, because I can have a person who can come in and be healthy. They're not on any medications, they're the perfect weight, and they're depressed as hell. So in my mind, they're not healthy because they're having difficulty getting to work, they're having other issues. So for me, it really encompasses, how do you feel about yourself? How do you look at the world? Do you have a support system? There's more. I hate to use, because it's such a common thing now, that mind, body, spirit thing, but really health encompasses all of it.
What we talk about is emotional health and medical health.
Right.
And I think in treating obesity, okay, we're really treating both.
Right.
And what's amazing is that we're doing it with a surgical procedure, which would seem really, or surgical procedures far outside. And you say, well, explain to me what you mean about emotional health. This is absolutely startling. Yale University once did a study that people would rather hire convicted felons than people who are morbidly obese.
Wow.
And on the surface, you'd say, that's absolutely ridiculous.
Right.
Okay? But if you really think about it, it becomes less surprising, because if you're seriously obese, a 3-year-old can see that. There are things in each of our pasts where if we don't disclose it, or don't have to disclose it, people don't know. And obesity is something that everybody sees. So it really affects people's emotional health. It's the last bastion of accepted prejudice.
Right.
And it comes into every single part of a patient's life. Then we add the medical parts to it, which we talked about, which are the things that we know about, that obesity increases your chance for hypertension, increases your chances for diabetes, it increases your chance for sleep apnea, it increases your chance of coronary artery disease. It makes it, if it's logical, if you're carrying an awful lot of weight, it's going to be more stress on your joints. It's even a condition called pseudotumor cerebri, where obesity can cause blindness. And young females, and it's often misdiagnosed, young females who are heavy wake up with headaches every single morning and get diagnosed as having migraines, and they have a condition called pseudotumor cerebri, which actually surgery is virtually curative to. So it's that interaction that we're treating. And we do so with this incredible, people hear me say that and they go, okay, that all makes sense. And then they go, well, but why can't they just lose weight on their own?
They can. It's hard.
Well, I think really this is something that we really have to spend a little time on, why it's so hard. You do this show every single week. So if we took 20 people and put ourselves in it, and we said we're going to do this show same time next year, different connotation than the movie, okay? And we wanted everybody to lose 10% of their body weight. We throw these numbers around, 10% of their body weight. Doesn't sound that bad. When my operations, and we make our operations sound better by saying 85% or 70% of excess weight. That's not body weight. That comes down to about 20 to 30%, of body weight. In order to lose 10% of your body weight, you have to eat 25% less. Now, that may be something you can do for a short period of time, but it's very, very difficult to do long term. So if we wanted to lose 10%, which is really actually a very significant amount in terms of improving your health, you have to eat a quarter less, and that's called set point theory. And what happens when we lose weight is our body becomes more efficient. People talk about, I have a slow metabolism. Really, heavy people have a fast metabolism because, again, you have to burn a lot of heat to keep a big body or a big house. We all know from this winter from our heating bills that if you have a big house, it's costing you a fortune. Well, if the house is smaller, your heating bill's less. So when you have a big house or a big structure, it takes a lot of energy to heat that at 98.6 degrees. And therefore you burn more calories. When you lose weight, you become more efficient. Your body your heart doesn't have to beat as hard. You're not huffing and puffing as you go up and down the steps. As a result, you become more efficient, so your metabolic rate goes down. And that's why it's so hard to lose weight. And the thing that I've really realized, in my career, and I've been doing bariatric surgery since 1994, is that I used to think that, I did stomach surgery and made the stomach small and, played around with the intestinal tract and people lost weight. Now I realize that the most important thing I can offer patients is hunger suppression. And this is the thing that we really don't understand, and it really gives you a better way of evaluating the different procedures. It's very easy to tell people what to do. And Sigmund Freud once said that the only thing insight cures is ignorance. And people wonder why we can't just do behavioral therapy. And it's not because it's a lack of education. It's because when people work all day, okay, and they come home, they're hungry. And unfortunately, everything that's easy to eat, that's well packaged, is what we don't want them to eat. And we all go through this, including doctors, and that's why I really think that one of my favorite quotes is insight only, the only thing insight cures is ignorance. And it's not a lack of education. There's a lot of other things going on. And once people have medical problems and serious obesity, they probably might have passed a critical point. And we really have to concentrate our preventive efforts on our kids, our high schools, even our adolescents, and really make these kids physically fit and really begin to define what we mean by health, because we really don't have a great definition of what that means.
No, you're absolutely right. That study that came out that the kids from the age of 5 to 8 are not going to live as long as we are.
First generation that's not going to outlive their predecessor, and the most common reason is obesity. And diabetes. And why do I think obesity is rising? And I think I think that you have two strange phenomenons going on.
Right.
Number one, and please don't start smoking. I think it's the inadvertent consequence of smoking cessation. It's like, if we're all damned in some way, maybe we all have an oral fixation in a certain way. But if you look at how smoking has declined, obesity has come up. And I've never seen that really spoken about by much epidemiologists, because they're so proud of their smoking cessation efforts. But I can tell you, I'm just a street smart kid from Brooklyn, and I can't tell you how many people have come into my office and said, I've gained 60 pounds, I've gained 100 pounds when I stopped smoking. And it makes you wonder about, as people are maturing, did they turn to food as their nervous crutch instead of to cigarettes? The second thing, and I think Michael Pollan has written brilliantly about this, is the net effect of industrial farming and the fact that corn was subsidized, and if you have cheap feed, you're going to have cheap cattle, and you wouldn't have cheap hamburgers if cows had to eat grass and be butchered. The thing is, everybody wants simple solutions, and they want unpainful solutions, but just sending nutritionists to school isn't going to be the answer. We're really going to have to make difficult choices from social engineering standpoints. But more importantly, or not more importantly, we still have an obligation, and we still have to provide treatment for adults and young people that have already fulfilled this destiny and have these medical problems. And we have to begin to look at what happens if we don't. One of the things people go, well, they did this to themselves. Well, unless the smallest part of every hospital in Westchester, except for the children's hospitals, the pediatric ward, okay? So you don't think that all of the lung cancers that people have, people played a role. You don't think all the vascular and cardiac disease we've played a role in our disease. You don't believe that, as we talked about, cancer is certainly dependent on lifestyle. We know cervical cancers are certainly related to viruses, which are related to, relations. We certainly know that obesity is related to colon, prostate cancer. We play a role in every single disease that we get. We really shouldn't draw the line and be judgmental